everybody, welcome back to the YouTube channel Mental Matters More. I am Amanda G, Psych NP, and this is the channel where we talk about all matters related to mental health. Have you ever self-diagnosed or tried to by using Google or TikTok? I know I have, and it's something that I've been hearing a lot about recently. I see a lot of people doing this. It's usually because there's something wrong and we're trying to figure it out at home by ourselves. So like anything online, you have to be careful, right? I have seen some depictions of mental health disorders on TikTok and Facebook that are pretty accurate. And then on the other hand, I've seen some really shady stuff that's not really factual at all. While there is some truth to diagnosing, I wanted to talk about ways you can identify if there's a problem at home regarding your mental health or loved ones, what programs are out there to help us, and what are the next steps to take. Things that you can do at home. This is called a PHQ-9, and it's an assessment that we use in mental health that can identify if an individual may need more treatment for depression. Another rating scale is called the GAD-7, and this is an anxiety rating scale. Both of these rating scales, if you score a 15 or higher, it indicates that you should seek out further treatment and contact a mental health professional. So you're going to contact a mental health professional in your area and get a further initial assessment. And this may include treatment options such as medication, therapy, holistic treatments, basically a plan developed around your specific needs. If you're experiencing severe depression or anxiety and you are having difficulties doing daily activities, work, school, taking care of yourself, taking care of responsibilities, you may be appropriate for programs such as IOP, intensive outpatient, or PHP, partial hospitalization programs. These are both great options for individuals who may not meet the qualifications to go inpatient, but we need more support than once a week therapy or meeting with a psychiatric nurse practitioner once a month. The way that you get set up in these programs is you would contact your local mental health hospital or facility. They would do an assessment for you and then get you set up based on that. These programs are great. I've recommended them to plenty of clients. I have family members that have gone through them, and they really can put you on a fast track to recovery. Another big question I get is, how do I know if it's a crisis, a mental health crisis? And this would include if someone was suicidal, yourself or someone that you know was suicidal. They have an intent and a plan. Brief suicidal ideation are thoughts that pop in our head and then leave. But if someone is truly suicidal or have thoughts about suicide, this would be a time when you would go to your local ER. You would call 911 or go to your local ER. And I would compare it to if you were having a heart attack. If you were having a heart attack, you would be in an extreme crisis and you will go to a local ER or call 911. And in mental health, that's the same with suicide. Another reason you may go inpatient is if you are suffering from a substance abuse disorder and you want to stop or address those behaviors and issues. It may put you on medication-assisted therapy, which is called MAT, and it will help you come off of the substance, opiate use disorder, alcohol use disorder, benzos, stimulants, and treat some of the symptoms and side effects that can go along with stopping a substance. I know you may be thinking, how am I going to do all of this? I have work, I have school, I have responsibilities. And the truth is, it's going to be a little bit challenging, but there are things that you can do. You may qualify for FMLA at your work, which would give you time off so that you could address your mental health concerns. If this is for a child, you may develop a 504 plan or can be put on medical leave. The good thing about COVID is we now have online school set up. They may be able to continue their schooling while they're getting some of these therapies. So what is our goal? Our goal is for you to be stable with symptoms in complete remission and living your healthy, best life. I know that it's confusing at times and we don't know what steps to take, but there are programs out there that can really help. If you're at a place where you are so depressed that you are unable to make a decision or you're unable to follow through with some of this, you can always call the National Crisis Suicide Hotline. The number is 1-800-273-8255. You can get in touch with a mental health professional that can do an assessment and come up with a plan for you on the spot. I think one of the biggest indicators for someone who has mental health disorder, successfully treating it and living a healthy, productive life, is their support system. So some of us have a support system, some of us don't. If you do, I recommend that you reach out to a family, friend, neighbor, teacher, and have them help you during this process. It's not easy. And if you don't, there are organizations, NAMI, N-A-M-I, National Alliance for Mental Illness, or other organizations that can help you, give you support, and walk you through this journey. Once again, I'm Amanda G, Psych NP, and this is the YouTube channel Mental Matters More. Today we were talking about how to identify if we have a mental health issue at home, what steps to take from there. If you are in crisis, please reach out. I will put the links for the organizations I mentioned in the description below. I've been seeing so many articles and Facebook and so much on the news about individuals taking their life due to depression and anxiety. And I want to let you know there's help out there. There are mental health professionals like myself that have dedicated our life to helping you. So just reach out. It's just a phone call away and things can get better. If you find this channel helpful, please subscribe. Please hit the subscribe button. Leave me some comments in the comments below. If you subscribe, put in a comment, I subscribed, and we'll continue making videos about mental health issues.